in HER2-positive breast cancer, trastuzumab, lapatinib, T-DM1, and pertuzumab show the survival benefit. But in gastric cancer, only trastuzumab showed the survival benefit. Therefore, there is still an unmet need for patients with HER2-positive gastric cancer. T-DXd is a novel antibody-drug conjugate consisting of a humanized anti-HER2 monoclonal antibody attached to a topoisomerase 1 inhibitor payload via a tetrapeptide-based cleavable linker. In a previous phase 1 trial, T-DXd shows a response rate of 43% in after standard of care, including trastuzumab-treated gastric cancer patient. Based on this result, we conducted a randomized phase 2 trial comparing T-DXd versus chemotherapy in HER2-positive advanced gastric or G-junction cancer. Patients who had received at least 2 prior chemotherapies, including 5-FU and platinum and trastuzumab, were randomized 2-to-1 to receive either T-DXd or physician choice Deruxtecan or paclitaxel. The primary endpoint was objective response rate by independent central review. The primary endpoint was significantly higher with T-DXd compared to that with chemotherapy, 51.3% with T-DXd versus 14.3% with chemotherapy, and a p-value of less than 0.0001, and also demonstrated statistically significant improvement in overall survival with T-DXd. Median overall survival was 12.5 months with T-DXd versus 8.4 months with chemotherapy. Even in most of patients received this therapy in third line. In terms of toxicity, around 10% of patients in the T-DXd arm had drug-related ILD or pneumonitis. So to conclude, T-DXd demonstrated statistically significant and clinically meaningful improvement in overall response and OS compared with standard chemotherapy in patients with HER2-positive gastric cancer. However, this trial was phase 2. Japanese regulatory authority will approve this drug, and T-DXd will be the standard third line of HER2-positive gastric cancer.